and stamp out the next big pandemic before it takes hold. Now on BBC World News, Claudia Hammond and Ian Panja with this month's Health Check.
Hello and welcome to Health Check, your monthly dose of global health stories. I'm Ian Panja.
And I'm Claudia Hammond. This month we've got a special programme for you because it's 10 years since the deadly disease SARS spread panic around the world.
We're at the Royal Geographical Society to talk about what happened and how it's affected our global view of health crises. Coming up.
A decade on, Kevin Fong travels to Hong Kong to meet some of the people at the heart of the SARS epidemic.
Claudia investigates the wider impact of SARS by finding out how scientists are working to reduce the risk of another outbreak in future.
And we'll be looking at how technology is breaking down barriers in mental health in Chad.
But first to our top story. The 10-year anniversary of SARS, or Severe Acute Respiratory Syndrome. It took just a few weeks for the virus to spread across the globe, affecting 37 countries, killing 775 people, and leaving 8,000 people fighting for their lives. But we're going to focus on Hong Kong, where the death toll was the highest. Kevin Fong went to meet some of those who survived.
Hong Kong, one of the most densely populated cities on Earth, and an international gateway for over 40 million businessmen and tourists. So when the deadly SARS virus took hold, it ended in a global emergency.
Good evening. Worries about the spread of the SARS virus have reached new levels.
The death toll has risen again today to more than 260.
In Taiwan, over 1,000 doctors, nurses and patients have been quarantined.
The World Health Organization is now advising against travel to Toronto, Canada's biggest city.
But the story starts here, not far from Kowloon Bay. In February 2003, a doctor checked in to what was the Metropole Hotel. Now, back in mainland China, he'd been treating patients with a rare and aggressive form of pneumonia. But what he didn't know, what he couldn't have known, was that that journey, taking him from the mainland to here, would be the triggering event in what would be a global outbreak.
As the doctor walked down the corridors, he was spreading not pneumonia, but SARS. 7 guests would be infected, and they would end up taking the disease around the world. One of those guests would admit himself to this hospital, showing the kind of symptoms that would soon ring alarm bells. Dr. Joseph Chan was working here at the time.
The most typical symptom would be fever. I think everybody's have fever. And